frontal bone, this is the ethmoid, this is sphenoid, this is the occipital bone. Okay. These pictures are from Magmin's Atlas. Magmin's Atlas. Download and see. It is original pictures. Netter, though I was a fan from my age of, class 2, I was a fan of Netter. And ultimately, those days, Netter was Atlas, and he was only for his illustrations. He was by the Siva company, Geigy company of United States. He was there. He was given a room or whatever, studio, and he used to paint those beautiful pictures in every like gynecology, ENT, everything you get. That is only by painting. But nowadays, with that, if you have an interest of seeing it, definitely you see it. But in these 2.5 months, I would say, don't explore anything. Otherwise, you go and climb the Everest. Some person died from Bengal, climber, and you will be killed. Don't explore. You read from your textbook. If you just want to see, you see your atlas, any atlas you have within you, or you just compare. But don't think that I'm telling you that you have to definitely, because my target is 60% pass. And the things are very, you don't panic. Now, this is the part of the sphenoid. This is the temporal bone, and this is the occipital. This is the foramen magnum. Next. Now, the posterior aspect. Now, this is the occipital, this is the sphenoid, and this is the temporal bone. And see, articulated. Now, these are the sphenoid, different aspect, different, it is the, now this is the occipital bone, in different, this is the internal surface, this is the external surface, this is the lateral surface. Now, this is the picture from Grant's, the dorsum sella, this is the superior orbital fissure, lacrimal, frontal bone, Brazilian, the foramen rotundum, Brazilian foramen, caniculus innomen, oval, foramen ovale, and foramen spinosum. This is the dorsum sella that lodges the pituitary gland. And see, this is a picture, a very old picture, black and white. And you can see how the man is there. Now, the optic canal is the foramen lacerum, the pterygoid canal is here, the carotid canal is here, is going. And see, if you, it is a saddle, the it's the man is sitting on a saddle. He put his two forearm into the optic canal, and this is what it looks. Now imagine I'm sitting there like that on the body of the sphenoid, and over here the pituitary gland is lodged. এক এক করে পার করবে, পরে আমি দেখাচ্ছি। এক নম্বর, now superior orbital fissure. The upper lateral part of the ring, the orbital branch of the middle meningeal artery, meningeal branch of the lacrimal artery, lacrimal nerve, frontal nerve, that is ophthalmic, fifth nerve, trochlear nerve, fourth nerve, superior ophthalmic vein. Middle part through the ring is the upper division of the occipitator nerve, nasociliary nerve, lower division of the occipitator nerve and abducent nerve. Lower medial part below the ring is inferior ophthalmic vein. Every textbook has very beautiful picture. This picture you have to definitely study because many questions or illustration 10 marks question can come from this aspect. Okay. Now, see the recurrent meningeal branch of the ophthalmic artery, superior orbital fissure. This is superior orbital fissure, lacrimal nerve, frontal nerve, trochlear nerve, superior ophthalmic vein is here, nasociliary nerve, abducent nerve, and lateral rectus muscle, the inferior rectus muscle, the superior oblique, superior rectus muscle. This is the optic nerve, and this is the ophthalmic artery. Now, this is the dural sheath and optic canal. This is the optic canal. The inferior rectus, third nerve, inferior ophthalmic vein. Now, the retina is, retina means your optic nerve, it's an extension. And the dura, it is covered by dura. So, if any patient with meningitis, encephalitis, they are admitted in the emergency. Please, and you see those clinically diagnosed. Meningitis, you can clinically diagnose, you can your any disturbance. You don't forget to check the eye. Eye means you ask, দেখতে পাচ্ছো কটা আঙুল এই তোমার আমার জামাটা কি রং, what is the color of my shirt, what is the how many fingers are there, you question. And if you say না দেখতে পাচ্ছি না ঝাপসা দেখছি, if I'm there's cloudiness, I cannot see what color it is. It is not that the patient is color blind. It's not that. That means the for meningism and encephalitis, the internal intracranial pressure increases, and CSF, that pressure that is flowing due to the inflammation and infection. So you call your ophthalmologist, but I would recommend, I would tell you, there are small beautiful ophthalmoscope is pocket size, pin size, like a pen or something like that. You are available, these Chinese, so you can observe yourself, you can see for yourself the types of, if there is any hemorrhage or any other lesion is there or not. And the optic disc actually swells up. So you can understand it might be hypertensive encephalopathy. Then the optic disc is pressure, and there might be in diabetic retinopathy. You can see the difference, and you see when you go and study medicine, you will see wonderful pictures of this optic disc and the thing. Now review of skull with identification of foramina and structures passing through the foramina. Review of skull with identification of foramina and structures passing through these foramina. That is the topic of the day. But you have to go back and see the base of the skull. Please see. At least the major holes, I will say holes, major foramina. If I ask you what is the jugular foramen, what is foramen magnum, what is this structure passing to you? This is theory questions will be there, and also you will be having practicals. It was just a skull bone. Opsi, you will be putting flag, a flag into the optic foramen or jugular foramen or external acoustic meatus. The pectus part of the temporal bone is also important. Now, structures passing through various foramina and canals and fissures of the skull. The total number of normal openings, foramina, canals and fissures in the skull is around 85. Okay, total number of normal openings of the foramina, canals and fissures in the skull is around 85, which provides paths to various nerves and vessels. Some of these are of the significance as they provide passage to minor neurovascular structures of no clinical significance. Attention should therefore be paid to those openings which provide your major neurovascular structures, past the neurovascular structures such as openings for one, the spinal cord and vertebral arteries, that is Foramen Magnum. 2, internal jugular vein, that is jugular foramen, and 3, internal carotid artery, that is carotid canal. Now, don't look for small minor details, but major. The foramen magnum, if you cannot see foramen magnum or you cannot identify this is the foramen magnum, foramen ovale, superior orbital fissure. Okay, now don't panic with this, but in case you examiner asks you how many foramens are there or canals are there, 85. That figure is you can easily remember. But don't panic. 85 mani hari baap re baap, kidhar jayega? Khopri nikal jayega. Khopri nikal jayega. Khopri se nahi. Okay. Now what I want to say is that you please don't panic around the number 85. But you see the importance of the spinal cord and vertebral arteries, that is foramen magnum, internal jugular vein, that is jugular foramen, and 3, the internal carotid artery, that is carotid canal. Now, this is the frontal air sinus. This is the group for the superior sagittal sinus. Now, this is the foramen magnum. Now, see crista galli. Okay. Now, this is the ethmoidal foraminas, anterior, posterior, and this is nasal slit. Now, frontal crest, frontal cecum, and your optic foramina is here, foramen rotundum is here, hypophyseal fossa, this is the fossa hypophysis, and foramen ovale is here, foramen spinosum is here, foramen lacerum is here, jugular foramen is here, and cerebellar fossa is here. This is the cerebellum. Cerebellum rests, the cerebral fossa. Internal occipital crest is the internal occipital crest. Now you see the skull and study this. Second thing, you take your book help, also your computers or laptops help, and you try to draw a circle like this and just label them. Make a hole with your pen, make a sinus, cleft or whatever it is like this. First, today's job is that you go home and see, you draw a picture like this. You just sketch and label them. Today you do it, again tomorrow repeat. Now this is the internal occipital crest. This is the internal occipital crest. Okay. And one thing is that, see, we are having beautiful bones. When you have the practical classes, you're having from today you'll have in dissection, whatever it is, and this component, Actually, even we used to fear. We had the same fear that probably skull, brain, you will carry, don't carry it like this. You just for this 1 week you do is this, is that you practice these figures and label them. Seeing the book. What you are seeing is the imprint. What is you are putting it in, just seeing and drawing and or writing, there's an imprint. So you can easily the frontal hair sinuses, crista galli, optic foramen, foramen rotundum, hypophyseal fossa, foramen ovale, and ovale to the foramen spinosum, foramen lacerum, foramen jugular foramen is there, the cerebellar fossa is there, internal occipital crest is there, and groove for the superior sagittal sinus, foramen magnum, groove for the transverse sinus, groove for the sigmoid sinus, superior border of petrous temporal bole, the superior part of the petrous temporal bole, internal auditory meatus, and the external auditory meatus you see in the lateral aspect of the see, this is the external auditory meatus, and here is the internal auditory meatus. Now, I am passing it to you. You please see it. I am passing it to you. Please see it and just hand it over to your next friend. Okay. Now, it becomes when you study with the specimen in the dissection hall and also in your rooms, you please draw a picture and sit together 2 or in 4. Okay. Now in the basis of crania interna, internal surface of the base of the skull, the cranial fossa. The structures passing through various foramina in the cranial fossa are described in chapter 21. In the basis crania external, normal basilis, inferior aspect of the skull. The inferior aspect of the skull is this. The inferior aspect of the skull. So you have to study in the classroom. Or you have your skull ache. You have a bone set you are having, but you are having a skull in any of you are having skull. Then you lucky enough to have a skull. Of course, you have your own skull, but I'm talking. Please, you have to repeatedly. You just practice by showing the original bones and also the pictures and correlate for 2 hours. You just do, and next day you, amongst yourself you take a test. Okay. Otherwise, you cannot cover up. Now, they are 2 in number, lateral incisive foramina, right and left present in the lateral wall of the incisive fossa, lead to the floor of the nasal cavity through incisive canal. They transmit greater palatine vessels, terminal part, nasopalatine nerves, terminal part only when the median incisive foramina are absent. Now, the incisive canal passes the greater palatine vessels and nasopalatine nerve. Now, medial incisive foramina. They are 2 in number, one present in the anterior and another in the posterior wall of the incisive fossa. They transmit left nasopalatine nerve passes through the one present in the anterior wall of the incisive fossa. Right nasopalatine nerve passes through the one present in the posterior wall of the incisive fossa. Greater palatine foramen, one on each side, located in the posterolateral angle of the hard palate. It transmits greater palatine nerves and vessels. Now, see, the name suggests the greater, like nasopalatine nerve. That means it is from the nose into the palate. Now, nasopalatine nerve present in the anterior wall of the incisive fossa. Right nasopalatine nerve passes through the one present in the posterior wall of the incisive fossa. Now, greater palatine foramen, one on each side, and see your one on each side located in the posterolateral angle of the palate. The palate to posterolateral angle, from there it comes down, greater palatine nerves and vessels. Now, what are the structures that passes through the palatine foramen? Greater palatine foramen. Greater palatine foramen. It will be greater palatine nerves and vessels. The nerves and vessels, the main key I told you that the structures of the nerve vessels are passing through these foramina. So, what greater palatine foramen? It passes the greater palatine nerves and vessels. Follow? Now, squamotympanic fissure. Now, squamotympanic fissure you will see in the temporal bone and present between tympanic part, palate of temporal bone and squamous part of the temporal bone, mandibular fossa. It is divided by the downturned part of the tegment tympani, a part of the petrous temporal bone, into pterotympanic petrosquamous fissure. Pterotympanic fissure transmits cauda-tympanic nerve, a branch of the facial nerve. Anterior tympanic artery, a branch of the first part of the maxillary artery, and anterior ligament of malleolus. Petrosquamous fissure, no structure passes through it. Present between upper surface of the sphenoidal process of the palatine bone and lower surface of the vaginal process of the sphenoidal bone. It transmits pharyngeal nerve, a branch from the pterygopalatine ganglion, and pharyngeal artery, a branch of the third part of the maxillary artery. Vomerovaginal canal. Vomerovaginal canal present between lower aspect of ala of Vomer and upper aspect of vaginal process of root of medial pterygoid plate. If present, it provides passage to pharyngeal nerve, a branch from the pterygopalatine ganglion. Pharyngeal artery, a branch of the third part of the maxillary artery. Pterygoid canal, present in pterygoid process of the sphenoid bone, connecting anterior wall of the foramen lacerum to pterygopalatine fossa. It transmits nerve to pterygoid canal, Vidian's nerve, and vessels of the pterygoid canal. Now, nerves and vessels. Now, the pterygoid canal passes the Vidian's nerve to second vessels of the pterygoid canal. Foramen ovale, foramen spinosum, emissary sphenoidal foramen lacerum. Now, carotid canal located on the inferior surface of the petrous part of the temporal bone. It transmits internal carotid artery with sympathetic plexus around it. Internal carotid venous plexus connecting cavernous sinus and internal jugular vein. Emissary vein connecting pharyngeal venous plexus and cavernous sinus. Tympanic caniculus located on the bony crest between carotid canal and jugular fossa and transmits tympanic branch of the glossopharyngeal or Jacobson's nerve. Tympanic branch of the glossopharyngeal nerve. Tympanic branch, that is, it supplies, goes through the tympanic membrane. Now, mastoid caniculus Arnold's canal. This can be a short note or MCQ. Mastoid caniculus. Mastoid caniculus Arnold's canal present in the lateral wall of the jugular fossa and transmits the auricular branch of vagus nerve, Alderman's nerve, Arnold's nerve. Stylomastoid foramen located between the roots of the styloid and the mastoid processes at the anterior end of the mastoid notch. It transmits seventh cranial facial nerve. This is, I showed you in the lecture, 2 slides, that the seventh nerve, how it is going to the your styloid, stylomastoid foramen located between the roots of the styloid and mastoid processes. The anterior end of the mastoid notch, it transmits seventh cranial facial nerve. Now, stylomastoid artery, a branch of the posterior auricular artery. These two structures are passing. Now, Foramen Magnum. Now, hypoglossal, anterior condylar canal, jugular foramen. Now, norma occipitalis, the posterior aspect of the skull, mastoid foramen, present on the posterior aspect of the mastoid process near the occipitomastoid suture. It transmits the emissary vein connecting the posterior auricular vein with transverse sinus. Norma lateralis, lateral aspect of the skull. The zygomatic temporal foramen present on the posterior medial surface of the zygomatic bone and transmits zygomato-temporal nerve, zygomatico-temporal artery, pterygomaxillary fissure present between the lateral pterygoid plate and posterior surface of the maxilla and transmits third part of the maxillary artery. Foramen infratemporal fossa to the pterygopalatine fossa. Maxillary nerve, second division of the fifth cranial nerve. Sphenopalatine foramen present in the roof of the sphenopalatine fossa and transmits nasopalatine nerve. Sphenopalatine vessels. Greater palatine canal present on the either side between the palatine bone and the maxilla transmits greater palatine nerves and vessels. That's why you see the relation of the this is the these are the pterygoid plates. The groups, the muscles are attached and go to the pharynx, and you will be seeing the vessels and the notches and the foramina. You have to have the skull in front of you and a picture in front of you when you are reading this. रटने नहीं होगा, रटना तो चाहिए, लेकिन mugging up, you will get puzzled. But at least you can see the foramina and what structures are passing through it. You can locate. In the norma verticalis, parietal foramen, now present on the parietal bone near sagittal suture and transmit emissary vein connecting superficial vein of the scalp of the superficial sagittal sinus. Now, the lecture on scalp, I told you, you can see, I showed you the emissary vein from the parietal bone is passing through it. In norma frontalis, superior orbital foramen or notch, present on the supraorbital margins and transmits supraorbital nerve, a branch of the frontal nerve, which is turns the branch of the ophthalmic division of the fifth cranial nerve. These nerves are coming like this. Comes through the foramen over here and it goes. Now, supraorbital vessels, the frontal diploic vein, superior orbital fissure. Now, inferior orbital fissure. Now, infraorbital foramen present on the anterior aspect of the maxilla below the infraorbital margin and transmits infraorbital nerve, continuation of the maxillary nerve, infraorbital artery, continuation of the maxillary artery, infraorbital vein. Now, zygomatico orbital foramen, zygoma orbital foramen, matico foramen. Now, present on the orbital surface of the zygomatic bone and transmits zygomatic branch of the maxillary nerve. Mental foramen, present on the external aspect of the body of the mandible below the interval between the premolar teeth and transmits mental nerve, a branch of the inferior alveolar nerve, mental artery, a branch of the inferior alveolar artery, mental vein, a branch of the inferior alveolar vein. From this, all this, the mandible, I took a class on mandible, it is like this. So you just have to, it's a rush through, you take your atlas, you take a white paper and go on drawing, label them. And also if you have a skull amongst you, you please do it in groups and study. And you come over here, your gates are open. You tell them, they are always will be at your help. Now, see diagrammatic picture. This is the emissary sphenoidal foramen of Vesalius. This is the superior orbital fissure, foramen rotundum, foramen ovale, canaliculus innominatus, foramen spinosum. Now, foramen lacerum, the four foramina in the greater wing of sphenoid are present along a concentric line. This one, the crescent. The concentric line, you can see the superior orbital fissure, the foramen rotundum, the foramen ovale, foramen spinosum, and canaliculus innominatus. Foramen lacerum is here. This is one picture, very descriptive. Now, cranial cavity chapter, these are from Bistam Singh. Now, structures passing through the superior orbital fissure. Now, I again repeat, this is the superior orbital fissure. This is the lacrimal artery, recurrent meningeal branch of lacrimal artery. A superior ophthalmic vein. Now, the nerves, lacrimal nerve, frontal nerve, trochlear nerve. Again, this is the superior division of oculomotor nerve. This is the abducent nerve. This is the inferior ophthalmic vein. Now, this is the optic canal, the optic nerve, the ophthalmic artery. Now, this is the optic nerve. And the superior division of oculomotor nerve, the nasociliary nerve, the sympathetic root of ciliary ganglion, inferior division of oculomotor nerve. Now, you can see, this is the internal carotid artery with sympathetic plexus. The internal carotid artery, these are the sympathetic plexus. Okay. And you will see the deep petrosal nerve and the greater petrosal nerve here. This is the cavernous sinus, and this is really the emissary vein, pterygoid venous plexus. Now, nerve of the pterygoid canal, this is nerve of the pterygoid canal. This is the sphenoid bone, deep petrosal nerve, internal carotid artery, sympathetic plexus around it. The meningeal branches of the ascending pharyngeal artery. Meningeal branches of the ascending. These are the meningeal branches of the ascending pharyngeal artery. Now, structures passing through the jugular foramen. This is jugular foramen, the inferior petrosal sinus. Now, the glossopharyngeal nerve, the vagus, this is 9th nerve, vagus nerve, accessory nerve, 11th nerve. Now, sigmoid sinus. Now, this is one. Now, this is again, I told you the other day, this is the medulla oblongata, the tonsils of the cerebellum, structures passing through the anterior spinal artery, the vertebral artery, spinal root of accessory nerve, the dura mater, this is the arachnoid mater, this is the pia mater, extra-dural space, subdural space, subarachnoid space, anterior narrow part of the foramen. Now, this see the anterior the foramen is, and see this is wide in, this is narrow, this is the narrow part. Okay. Now, now see, again I repeat, because this is a very common question. If you are asked to hold a brain and spinal cord, or you have the brain with the medulla oblongata and the cerebellum, the composite the thing viscera of the brain, then they'll ask you, what are these structures? This is cerebellum. What are these structures? The medulla. Now, you relate with the skull. And what are the structures that is passing through the foramen magnum? Okay. Nasopalatine hand, and don't kill yourself. But the major opening, superior orbital fissure, inferior orbital fissure, foramen magnum, and your now this is the apical ligament of dense superior band of cruciform ligament. This is the membranotectoria, anterior narrow part of the foramen is here. Now this is the narrow part. This is the narrow part. This is a schematic diagram. Naturally, whatever it is you see like this, to make it easy and understandable, that's why it is drawn like this. Okay, and the shape is also a bit like this. Now see the brain and its meninges. It's coming down. The spinal cord is coming down. Naturally, with the sheaths of the coverings of the spinal cord, naturally, see, this is the dura mater in brown, this is the arachnoid matter in mauve color, and pia mater blue here. These are the extra-dural space. Dura mater se agar extra-dural space. See, if a hemorrhage is there, it is extra-dural, it causes less damage. But if you see by serial MRI or CT that how much the quantity, volume of the hemorrhage, then accordingly you have to try and drill a hole and in the skull, and that blood clot and other it's a wound, naturally wound fluid, that you have to take it out and then save the patient. Now, see, naturally, ঠিক আছে?